Hi everyone, I am Dr. Divya Shanthi and welcome to NEET PG Core Revision series. These series are structured, focused and exam oriented so that you can recall faster and more confidently in your exams. In today's session, we are going to break down the anatomy of coronary circulation into clear, high-yielding, exam-oriented concepts. So let's get started. The heart is supplied by two coronary arteries, the right and the left, and that is why we call the circulation as coronary circulation. So we have the right coronary and the left coronary supplying the heart through its branches. Now these arteries we call them as the vasa vasorum of ascending aorta. Okay, so vasa vasorum is a blood vessel supplying a blood vessel. So because here the ascending aorta is giving rise to these which are supplying the heart, we call them as the vasa vasorum. Okay, so each coronary artery is known as the vasa vasorum of the ascending aorta. So here the ascending aorta, if you see, so this is the ascending aorta. This is the pulmonary trunk here. So this ascending aorta will have three openings here. Okay, so three sinuses we call them, and those sinuses are also known as the sinuses of Valsalva. So these sinuses we call them as the aortic sinuses. So they are all aortic sinuses. So these aortic sinuses, we have one anterior and two posterior aortic sinus. So posterior aortic sinus, we have a right one and a left one. So the right coronary artery, if you see here, it comes from the anterior aortic sinus. Anterior aortic sinus gives origin to the right coronary artery. Whereas the left coronary artery, it begins from the left posterior. Okay, so the left posterior aortic sinus gives origin to the left coronary artery. So this is how we see in a section. So if you open the ascending aorta, this is how we will see. So this is the right, this is the anterior aortic sinus, and here we have the right origin of right coronary artery, and this is the origin of left coronary artery from the left posterior aortic sinus. So the right posterior aortic sinus, if you see here, it doesn't have any openings like this. So this is known as the non-coronary aortic sinus. Okay, and all these aortic sinuses, they are known as the sinuses of Valsalva. So next we will see the origin of each of these coronary arteries. So if we take first the right coronary artery. So the right coronary artery, it begins from the anterior aortic sinus. So otherwise we also called as the right coronary sinus, okay, of the ascending aorta. So first the artery, when it begins here, you can see it passes forwards and to the right between the pulmonary trunk. Now this is the pulmonary trunk and the auricle of this is the right auricle. Okay, so it passes between that pulmonary trunk and the right auricle and then passes downwards. So the right coronary artery, after it originates from the anterior aortic sinus, okay, anterior aortic sinus, which is otherwise called as the right coronary sinus of ascending aorta, it passes forwards in the anterior intraventricular, right anterior atrioventricular groove. This is between the atrium and the ventricle. It passes forwards along this groove, okay, between the pulmonary trunk and the right auricle. Okay, so between the pulmonary trunk, this is the pulmonary trunk, and between the right auricle it passes. Then here you can see it winds around the inferior border. Okay, it winds around the inferior border of the heart and passes. Okay, as we see the right coronary artery, it will pass upwards and to the left. Okay, it passes upwards and to the left along the posterior part of the atrioventricular groove. Okay, so this is the posterior part of the atrioventricular groove. Then it reaches the crusk of the heart. Okay, so the crusk of the heart is the meeting point of four grooves. We have the interatrial, interventricular and the atrioventricular, posterior intraventricular grooves. Okay, so that is the crusk of the heart. Okay, so crusk of the heart where we have interatrial, atrioventricular and the interventricular, posterior intraventricular grooves which meet there at the crusk. So this artery, the right coronary artery, it ends at the crusk of the heart by anastomosing with the circumflex branch of left coronary artery. So here we have to remember that the right coronary artery, its termination happens in different ways. Okay, so about 60%, okay, in 60% we see it terminating at the crusk by anastomosing with the circumflex branch of the left coronary. Then in about 10%, okay, in 10% it will end at the inferior border itself, inferior border of the heart. In another 10%, it reaches the interval between the inferior border and crusk of the heart. And rest 20%, it will go along the entire, okay, so posterior part of the atrioventricular groove. So it will traverse along this posterior atrioventricular groove. So that is about the termination. So right coronary artery can terminate in these four different ways. So normally in 60%, like majority, it is at the crusk of the heart. So that is the course of the right coronary artery. So to summarize, so it begins from the anterior aortic sinus, runs between the pulmonary trunk and the right auricle initially, and then along the anterior atrioventricular groove. It will pass, then winds around the inferior border of the heart, and then it reaches the crusk of the heart in the posterior part of the atrioventricular groove, and it ends at the crusk of the heart in 60% of the individuals by anastomosing with the circumflex branch of left coronary artery. So that is the course of the right coronary. The left coronary compared to the, so this was the right coronary artery. So if you see the left coronary artery, okay, left coronary artery is very short. So the left coronary artery, soon after it begins from the left posterior aortic sinus, it runs for a very short distance between the pulmonary trunk and the left auricle, and immediately divides into two branches, that is the circumflex and the anterior interventricular. Anterior interventricular. Okay, which we also clinically we call it as left anterior descending in clinical practice. So that is the short course of the left coronary artery. Okay, so this anterior interventricular artery will wind around the inferior border, and then it will be anastomosing with the posterior interventricular artery, which is a branch of the right coronary. And the circumflex, it winds around the left atrioventricular groove, and then it will go, and at the crusk of the heart it will be anastomosing with the right coronary artery. So that is the course of each of these coronary arteries. So this is the circumflex branch, which we see. Right. So now we will, so here you can see this is the crust of the heart. So where we can see, okay, so this is the right coronary. We can see here behind will be the circumflex. Here we see this is the posterior interventricular groove, where we will see the anastomosis between posterior and anterior interventricular arteries. Okay, so that is how the course of both the coronary artery is. Now let's look at the branches of each of these coronary arteries. Okay, so here these arteries, the right and the left coronary arteries, will give atrial rami and ventricular rami, that is atrial branches and ventricular branches. So among the ventricular branches, okay, so of the right coronary, first let's see of the right coronary. So the ventricular branches here, okay, ventricular branches, we have the right conus artery. Okay, so first one is the right conus artery. So right conus artery is the first branch of the right coronary artery, and it supplies the infundibulum here, okay, infundibulum of the right ventricle. So sometimes this right conus artery, it comes directly from the anterior aortic sinus, and that time we call it as the third coronary artery. So if they ask what is third coronary artery, it is nothing but the right conus artery when it directly arises from the anterior aortic sinus instead of from the right coronary, and it supplies the infundibulum of the right ventricle. And this right conus artery will anastomose with the left conus artery, and it will form, okay, the left conus, which is derived from the circumflex branch of the left coronary, and it forms what we call it as the annulus of Wiesen's. Annulus of Wiesen's. Okay, Wiesen's, annulus of Wiesen's. So this is annulus of Wiesen's is nothing but the anastomosis between the right coronary and the left coronary. Then we have the right anterior ventricular. So it gives many right ventricular rami, among which the right marginal artery is the longest, right marginal. Okay, so this is the right marginal here. Okay, right marginal, which is the longest. So this is in the anterior part, the branches which are given. In the posterior part, it will also give the posterior ventricular rami. Okay, so posteriorly also it will give the ventricular branches, and it also gives this branch. This is the posterior interventricular artery, interventricular artery. Okay, so about in 70% of the subjects, this posterior interventricular artery comes from the right coronary. So these are the ventricular branches, and among the atrial branches, okay, so atrial branches, it gives the atrial rami, okay, atrial branches or atrial rami. So among this atrial rami, one important branch is the sinoatrial nodal artery, SCA nodal artery. Okay, so SCA nodal artery, so about in 65% of the individuals, it arises from the initial part of the right coronary artery itself. Okay, so from the, and about 35% we can see it in the from the circumflex, that is the SCA nodal artery. So these are the branches of the right coronary. And we have to also remember that the posterior interventricular artery will also give septal branches. Okay, so septal branches supplying the interventricular septum. Next, coming to the branches of left coronary artery. Okay, so the left coronary artery immediately, soon after its origin, it will divide into two branches here. One is the left anterior descending, another one is the otherwise called as the anterior interventricular, and we have the circumflex. So anterior interventricular, here it is basically the continuation of the left coronary artery and it descends downwards here in the anterior interventricular groove. Then near the apex of the arch, it winds around that apex and then it goes to the posterior interventricular groove where it will anastomose with the posterior interventricular artery. So here this one will give the ventricular rami. Okay, so ventricular rami. So the left anterior descending will give ventricular rami for both ventricles, right and left ventricles. Of this, one branch will be very prominent and large, and that is known as the diagonal artery. Diagonal artery. Then it also gives the septal branches and supplies the anterior superior 2/3 of the ventricular septum. Okay. So posterior inferior 1/3 is supplied by the posterior interventricular, anterior superior 2/3. Okay. Anteriorly and superiorly 2/3 of the interventricular septum supplied by the left anterior descending branches. So that is about the left anterior descending or the anterior interventricular artery. Coming to the circumflex, okay, so the circumflex artery, it will give important branches here. So this circumflex branch of the left coronary artery, it passes, after it begins, it passes on the left atrioventricular groove, winds around the left border of the arch, passes behind between the posterior part of the atrioventricular groove, reaches the crest of the heart where it will anastomose with the right coronary artery. So now this circumflex artery, to remember the branches, remember slap. Okay, a mnemonic slap, just to remember the branches. So most of its branches are occasional branches, so it may give those branches. So S is SCA nodal artery. So in 35% of subjects, the SCA nodal artery can come from circumflex. L is for left marginal artery. So it is a branch from the circumflex. So you can see here, this is the left marginal. Left marginal here. Then we have atrial branch of circumflex artery. Okay, and this atrial branch can anastomose with a similar branch, okay, coming from the right coronary. The atrial branch of circumflex will anastomose with the atrial branch of right coronary artery, and that anastomosis is known as 𝗔𝗔𝗃 artery. 𝗔𝗔𝗃 artery. So 𝗔𝗔𝗃 artery is nothing but the anastomosis between the atrial branches of right coronary and the circumflex branch of left coronary. And P is for posterior interventricular artery. Posterior interventricular artery. So this posterior interventricular artery in about 10 to 20% of individuals can come from circumflex. Okay, circumflex branch of left coronary. So majority 70% it comes from the right coronary itself. So these are the branches of the right and left coronary arteries. So there is an important terminology known as the coronary predominance. Now what do we mean by coronary predominance? Okay, so from which artery, that is which coronary artery we have the posterior interventricular artery coming from. Based on that, we call it whether right or left coronary predominance. So if the posterior interventricular artery is mainly from the right coronary, okay, so if the posterior interventricular artery is mainly from the right coronary, we call it as the right coronary predominance. So in 70% of the subjects, it is mainly right coronary predominance. And if the posterior so here you can see the posterior interventricular is coming from circumflex, okay, is coming from the circumflex branch of left coronary. So if the posterior interventricular is from the circumflex artery, which is branch of left coronary, we call it as the left coronary predominance. Okay. So sometimes we can see the posterior interventricular artery coming from both the right as well as the circumflex, okay. So from both right and circumflex, right coronary as well as circumflex it comes. So this we call it as the balanced type, okay, this is the balanced type. So that is all about the coronary predominance. So clinical correlation here. So the most common cause of death, okay, most common death in affluent society around the world is mainly because of ischemic heart disease. So this ischemic heart disease results from occlusion of these coronary arteries, okay, or its coronary arteries or one of its major branches. So here what happens is there is gradual formation of an atheromatous plaque, okay. So the cycle goes like this. So there is a formation, gradual formation of atheromatous plaque. So this plaque forms beneath the endothelial lining of the artery. So beneath the endothelial lining we see the atheromatous plaque. Now sometimes what happens in this atheromatous plaque, okay, there will be formation of an ulcer, okay. So on this ulcer there will be aggregation of platelets, okay. So the platelets will aggregation of platelets which results in thrombus formation. And this results in narrowing of the vessel. So because of which the blood supply is compromised and it results in ischemic heart disease or myocardial infarction. So if there is sudden or sometimes this thrombus gets dislodged and it blocks, okay. So because of which there is sudden obstruction in the blood flow, and in case if it involves a major blood vessel, it can result in sudden death also, okay. And yeah, so clinically, okay, so here among the arteries and the branches, the commonly affected in heart disease, involved in coronary heart disease or ischemic heart disease is the left anterior descending or the anterior interventricular artery, so branch from the left coronary. So in about 40 to 50% it is the left anterior descending which is involved. The second vessel which is involved is the right, second common is the right coronary artery. So right coronary artery we see it about 30 to 40%. And the circumflex branch is the last, okay, circumflex, the next branch is the circumflex branch and we see it in about 15 to 20%. So these are the three commonly affected arteries which are involved in coronary artery disease. In addition to that, the diagonal artery, the left marginal and trunk of the left coronary is also involved, but less common, but these are more common. So in case of major occlusion, major ischemic heart disease where there is a lot of ischemia and the blood supply is compromised, in those cases we do what we call it as the coronary bypass surgery. So for the coronary bypass surgery, so here what we do is we take a vessel and we connect it, okay, we anastomose it to a major blood vessel like the ascending aorta or to the subclavian, and from there what we do is we anastomose it to the whichever vessel is occluded, okay, or which is blocked distal to it, so that the distal to the occlusion so that the blood supply is regained. Okay. So the commonly used blood vessels here are the great saphenous vein. Great saphenous vein is commonly used. Other than that, the left internal thoracic artery or internal mammary artery is also used, and sometimes the radial artery is also used. So these are the blood vessels which are used in coronary bypass. So common is the great saphenous vein, which is so usually that is used. So this is how it is anastomosed. Next, coming to the venous drainage of the heart. So about 60% of the venous drainage of the heart, okay, it is mainly to the right atrium by the coronary sinus. The remaining 40% drains into different chambers of the heart through two things. One is the venae cordis minimarum, which are also known as the Thebacean veins. Another one is by the anterior cardiac veins. So these are the veins which drain the heart. So mainly it is by the coronary sinus. So the coronary sinus, okay, it conveys the greater part of the blood from the left coronary, whereas the anterior cardiac veins mostly drain the blood from the right coronary artery. So here we can see these are the anterior cardiac veins. So anterior cardiac veins, they drain the infundibulum of the right ventricle and directly they drain into the right atrium. Okay, so through the foramen minimarum. The venae cordis minimarum, they open into the different chambers of the heart. Okay. So the coronary sinus basically conveys the greater part of the blood from the left coronary, whereas the anterior cardiac veins from the right coronary arteries. Now the coronary sinus, okay, so a little bit about the coronary sinus. So the coronary sinus, if you see here, it's a venous channel about 2 to 3 centimeters long. Okay, it is about 2 to 3 centimeters long and is situated in the posterior part. Okay, so whatever this dotted line you see, this is the coronary sinus. So it is situated in the posterior part of the atrioventricular groove. So it receives 60% of the venous blood of the heart. So once it begins in the left part of the atrioventricular groove, okay, here it receives this is the great cardiac vein. Okay, it passes downwards and to the right. So here you can see it passes downwards and to the right along the posterior part of the atrioventricular groove here, and then it opens. Okay, it opens into the coronary sinus opening. Okay, coronary sinus opening in the right atrium. So right atrial chamber, that is the posterior wall of the right atrium, it opens. So the opening of this sinus is guarded by a semilunar valve, which we call it as the Thebacean valve. So coming to the tributaries of it, okay, so the tributaries of coronary sinus when we see, okay, so here all of these tributaries, they are provided with valves except for the oblique vein of left atrium. Okay, so which are those veins now, tributaries? One is the great cardiac vein. So the great cardiac vein, here if you see, it begins from the apex of the heart and passes upwards along the anterior interventricular groove, and then it will join the coronary sinus. Then we have the middle cardiac vein. So middle cardiac vein, it passes from the apex. Okay, so from the apex region, the middle cardiac vein goes. So the apex along the posterior interventricular groove. So here you can see this is the middle cardiac vein. Then we have the small cardiac vein. The small cardiac vein is situated in the atrioventricular groove between the right atrium and right ventricle. Okay. So here we will see the small cardiac vein. This is the small cardiac vein. Then we have fourth cardiac vein. We have the posterior vein of left ventricle. So posterior vein of left ventricle, we will see here posterior vein of left ventricle. Okay. And we see one more is the oblique vein of left atrium. This one here. Okay. This is the oblique vein. Now here you have to remember, this oblique vein is the remnant of an embryological structure, that is the left duct of Cuvier. Okay. So this, except for this, the rest of all of them, they have the valves. So here we can see the coronary sinus on the posterior aspect. So this is the great cardiac vein which is joining here. We can see this is middle cardiac. This is great cardiac. And here we have small cardiac. This is the posterior vein of left ventricle, and here we see the oblique vein. So these are all the tributaries of the coronary sinus, and we can see it opening into the posterior wall of this is the right atrium. This is inferior vena cava. So next to that, here it opens and it is guarded by a valve which is known as the Lebesgue valve. So that is about the coronary sinus. So coming to some of the image based MCQs, the left here you can see the coronary circulation shown is best described. So here we can see the posterior coronary circulation when we say according to what they have given, left dominant, right dominant, codominant and balanced dominant. Okay. So what we have to see? We have to see the origin of posterior interventricular artery. So here we can see the posterior interventricular artery is coming. This is the posterior interventricular artery coming from the right coronary. So it is right dominant. The highlighted artery most commonly supplies. Okay. The highlighted here, actually it is a little here. This one, the anterior interventricular. So the anterior interventricular artery, it supplies the anterior and superior 2/3 of the interventricular septum. The artery supplying the AV node most commonly arises. Okay, the SC node, AV node, those arteries, they commonly arise from the right coronary artery. The label structure drains into. The label structure drains into. Label structure is nothing but the coronary sinus. And where does it drain? It drains into the right atrium. So B is the right choice. The labeled vein here. Okay. So the vein is labeled here. So this vein, you can see it running in the anterior interventricular groove. So this is the great cardiac vein. So that's a wrap on today's session of coronary circulation. So each of these revision series will bring you closer to your NEET PG dream. So stay focused, stay consistent and trust your preparation. I'll see you in the next session.